We're going to talk about women's cancers, and then my subtitle is a primer and review. Now, whenever I come up with a new topic, I think, why would this be important? Why would people really care? Well, for those of you who are women, you have a very selfish reason, I suppose, to care. For those of us gentlemen, certainly we have women in our lives that are very important to us. These are a couple of the women who are important in my life, my sister, my wife, my godmother, and many other women who I have had the pleasure of caring for, learning from, and personally be invested in. So this is a very important topic for all of us. My goals today are to review some basic definitions and tenets about cancer, to overview some of the basic statistics, visit the classroom. This is going to be a little bit challenging for us, going through the anatomy and physiology of some of the body parts, review some common cancers, propose some models for possible cause, and discuss opportunities for prevention. It's a lot, but we can do it. These are not my goals, just as important. I am not here to give you personal recommendations for screening or treatment. I am not here to give you updates on surgical techniques or to offer alternative treatments to commonly used modalities. That is not my purpose or my intention. So what this is, this talk is the beginning, not the end. It's unfinished business. It's incomplete, with the goal that I will raise more questions for you than provide answers, so that you will then begin to seek out the answers further yourselves. Because we are called to be lifelong learners as natural hygienists and as humans. So let's start at the very basic, the very beginning, with a definition. Cancer, what is it? The definition that we'll choose to focus on is the bolded one. A malignant tumor of potentially unlimited growth that expands locally by invasion and systemically by metastasis. A metastasis means when small little portions or particles flick off and go somewhere else in the body and begin a cancer growth in that area. To use the National Cancer Institute's definition, cancer is a term used for diseases in which abnormal cells divide without control and are able to invade other tissues. So it's abnormal. It's not normal, in other words. Now, we can look at the organism in many different ways. We can start out at the microcosm and talk about the atomic structure of the organism, the carbon, the oxygen, the hydrogen, etc., that we're all made up of, and in fact, most of existence is composed of. We can talk at the molecular level, where we talk about DNA and RNA and all of these different complex perspectives. We can talk about the organelle level, which are the little organs, the miniature organs of each cell. We can talk about the cell itself, the building block of life, if you will, and then we can talk about tissues, where cells come together to function together for a purpose. Then we can talk about organs, the organs of the body. We can also talk about organ systems. So a system in which many different organs come together to work for a central purpose, such as the respiratory system or the circulatory system, which obviously the heart, the veins, the arteries, all together. So many different ways in which the complex body is gathered together to function as a whole organism, as an entire human being. So let's start out with our friendly little cell. As I said, the building block of life. And this is a prototypical cell, the nucleus, where all the DNA and RNA information is, and many different unusual little names here that really aren't that important for us, but they each have different functions, producing energy or producing proteins or producing further cell membrane, etc. But this is at the heart of each of us. We are composed of trillions of these cells, as we heard earlier today. Now, cells, just like humans, go through cycles. And these cycles are composed of, you're getting pretty deep in medical school here, guys, go through many different aspects. The cell doesn't just sit there and do nothing or suddenly abruptly go into something. It actually smoothly, in a good, appropriate pattern, goes through growth. Then it replicates its DNA. Then it prepares. And then it goes through something called mitosis. And mitosis is the splitting off of one cell and forming two cells from it, two daughter cells, if you will. And in that way, our bodies were formed at the very beginning, as well as continue to maintain themselves. Now, here's why I put this slide up. Because these two places within this cycle are where our body is able to identify abnormalities in this cycle. And say, wait a second, you moved too quickly through that part, and now things are off a little bit. Or wait a second, you forgot to multiply chromosome number 16. And so this can't happen. They are checkpoints at which the body amazingly is able to, at every cell level, check and see if things are going right. And if things aren't going right, the cell can say, well, I'm going to cause this cell to die. A process called apoptosis, or suicide, cell suicide. So at that checkpoint, they say, are you normal? Are you correct? Are you right? Are you ready to go on to the next phase? If not, go back or die. If you are, move forward. Now the problem happens, cancer happens, when that cell, that normal pattern of assessment and evaluation is faulty. When it becomes faulty, this cell that otherwise would have normally gone multiply here, then been damaged, and the cell would have said, oh, well, you're damaged, so I'm going to cause you to have suicide and die off. And it would have just killed off that cell line, and we would have had no problem. But in cancer, this fails to occur because there's some defect at that checkpoint level. And as a result, this cancerous cell, this cell with a slight defect in it, begins to multiply. And if additional changes happen in the DNA or other structures of the cell, then it becomes even more and more mutated, as you can see, until it is just growing uncontrollably. Now, it's very interesting that in modern science, we say that all of you, myself included, have cancerous cells in us right now. We do. But the body, in its amazing ability, is able to sense that these cells are cancerous, are inappropriate, are incorrect, and cause them to have suicide, or sends in what are called macrophages, or other type of white blood cells, to destroy and eat up those cancerous cells. But it's when those cells are not identified and are able to continue to multiply and have further mutations that we can end up with true problems with cancer. So when we speak of cancer itself, these are two concepts I want you to keep in mind. A failure to block abnormal growth, or an acceleration of growth that is inappropriate. So we can go much more complex, much deeper, but these are the basic concepts in the back of your mind you want to think of when somebody speaks of cancer. There's been an abnormal growth, a failure to check that growth, or there's been an acceleration of the growth. Something that went onto that cell, onto that tissue, and caused it to multiply rapidly. Okay? Keep that in the back of your mind. The honest truth, of course, is the cell cycle is far more like this. I hate to throw that up there, but that's far more the truth. Not that simple, beautiful little circle with the two checkpoints and that's it. But in fact, that there are a multiplicity of different places in which the foods we eat, the environment we're in, our genetic history, our personal history, the toxins we're exposed to, all influence that cell cycle and influence the cell's development. But for us, because I am a simple person, we need to keep in mind that simple concept of checks and balances. And again, this is right on, but it's just a little more complex. These are important terms for us to have in the back of your mind. You may not remember these as you leave, but you'll hear people speak of these. So it's good to know what they are, the general idea. Carcinomas are cancers that occur on the covering or the internal organs. Okay? So on the tissues or skin that line or cover internal organs. A sarcoma is a cancer that's in either bone, cartilage, fat, muscle, blood vessels. In other words, connective tissue, or what we call soft tissue. Leukemia is cancer in blood-forming tissues. Lymphoma, cancer of the immune, and central nervous system, obviously in the brain or the spinal cord. This is how we break down cancers. See, I believe that we as natural hygienists need to be able to talk about everything. We need to be able to have conversations, cogent, meaningful conversations about health, about our bodies. So we need to know some of these terminology. We need to be above the average Joes, if you will. So, and one other thing here on valuable terminologies, and that is this. You'll hear of someone who's diagnosed with cancer, and then they say, I've been staged. I'm getting staged. That means an evaluation of the extent of a person's cancer. So that's where, say, for example, I was unfortunate enough to be diagnosed with a cancer of the kidneys, and I went in to be staged. Well, they would go in and they'd do a CT scan of my whole body looking for cancer in other places. They do something called a PET scan that would also light up areas of different types that might be cancerous, etc. So that's where they're looking for any cancer in other parts of the body. When it comes to grading a cancer, that means where they've taken a small sample of it and under a microscope, they're able to see what level in many grading systems that cancer is. If it looks really big, bad, mean, and ugly, it's a lot worse than if it's just some little friendly-looking cancer. And the way they can tell that is by looking at the cell and the cell's shape and the manner in which those cells multiply, okay? So if those cells actually have weird little outgrowths on them or are particularly large and some really tiny, that's not good as compared to if the cells look relatively about the same, but they're just more than there should be, okay? You with me? Yeah. All right. I'm not putting you to sleep, am I? All right. So, what do we know? Cancer is an abnormal state of the cell. It's often caused by dysfunction in the cell cycle. And overgrowth or inappropriate growth at the cellular level is equal to dysfunction at the tissue and organ level, which can result in dysfunction at the organism's level. But it all starts down at that cellular level. That's why what we do at that level is so important. Now we're going to turn a little bit and look at basic epidemiology. We're going to talk a little bit about, well, what type of cancers are common. In particular, since it's our discussion today, women's cancers. When I speak of women's cancers, I'm going to be discussing breast cancer and gynecologic cancers. The gynecologic cancers, those of the uterus or endometrium, the cervical cancer, and ovarian cancer. These are the most common, what I define as women's cancers today. So when we talk about cancer, it's important to keep in mind, is cancer really a big risk? Is it really a problem? What do the numbers tell us? What do they show us? Should we even talk about it? Well, in fact, as you can see here, malignant neoplasms or cancer are the second leading cause of mortality in America right now. Second only to diseases of the heart and just above stroke and chronic respiratory disease. When you break down the mortality rates, men versus women, you can appreciate there are about 1.2 million new cancers per year diagnosed in the US. And of these, about equally split between men and women. And of them, we're looking here at cancer deaths, because although there are more breast cancer cases in the US, breast cancer tends to be less aggressive than lung cancer is. And we're going to focus again on exclusively women's cancers, so not on the other cancers. You can see the breast cancer, ovarian cancer, and the uterine cancer here. Just take a look at those numbers for a moment, kind of keep in the back of your mind, because we're going to talk a little bit about preventive approaches later on. I want you to think in your mind, start thinking, well, what are things that my friends, my family, myself could do that may be risks for me? This is a very depressing slide to me. We have spent trillions, at least hundreds of billions, if not more, of dollars on cancer care since the 1940s and 1950s, in a Nixonian sort of army approach of burn and radiate and cut out and the rest. Yet when you look at overall mortality across the board since 1930s, you can appreciate a rather depressing picture there. Many of these cancers are unchanged. In particular, breast cancer mortality is largely unchanged. That's the breast cancer curve there. We have made some gains when it comes to uterine cancer with a slight decline, and that includes cervical cancer in there. We'll talk a little bit about that, but not a significant change since the 1950s there. And then when you speak of ovarian cancer, unfortunately, not a significant change either. Wow, huh? The one that went up there is lung cancer. Hey, camels go for women and men alike, right? Come on, it's sexy. So unfortunately, you saw that when women began to smoke back here in the 30s, 40s, and 50s, thanks to a lot of the media attention, etc., in the next 20 years, we began to see a significant increase. We do see a decline there also of stomach cancer, which has slightly declined. So what that comes to, that cancer risk for these common women's cancers, total 1 out of 3 women in general American population will get one of these cancers in their life. And of that, breast cancer, 1 in 8 women, uterine cancer, 1 in 37 women, and cervical cancer, 1 in 117 women. These are data from the National Cancer Institute. Whether we agree with them or not, they certainly provide us a rather provocative picture of the rate of cancer in the US, in particular in women. So in review, cancer is the second leading cause of death, second to heart disease. Breast cancer is the leading female cancer, as I mentioned. And when you look at the cancer mortalities, it's rather a sobering picture. I would offer that perhaps it's because we're not looking at the right things to address. We're not addressing cancer in the right ways. But I want you to learn more about that and have your own opinion. But all in all, cancer risk is quite significant, and it's quite real for all of us. And so we need to take it very seriously. Now, your reaction to this may be one of fear or one of anxiety. But I hope that in being a part of this organization, with the education that you're receiving, as well as in the own work that you're going to be doing, you will feel more educated, empowered, and motivated, and begin to lose some of these feelings. Because to me, it was quite anxiety-provoking just looking at those numbers. But let me give you a different perspective to help you as well. In the United States right now, the rates of hypertension in adults, look at the rates. 70-something% of individuals over the age of 75, 70%, you can see the numbers there yourself. But you can appreciate that certainly these numbers are far worse than 1 out of 8 or 1 out of 13, 1 out of 15. And yet for us as natural hygienists, we know that hypertension is completely you can eliminate it completely, 100%. Done, gone. Do I think that's the case with cancer? Not necessarily. But do I think we can dramatically reduce our risk? Absolutely. So I think it's important when we look at numbers provided by the government or other institutions to really look at that and say, well, wait a second, what are our real risks? Because certainly for females, your risk of coronary artery disease and stroke are far away higher than your risk of breast cancer, which we said was the most common women's cancer. That doesn't mean we shouldn't be concerned about the rest, but it does alter that sense of fear and anxiety, I hope, for you ladies out there and for those of us who care about the women in our lives. All right, big breath, because we're about to do something painful. I mean, enjoyable. We're going to go to mini med school. Yay! I know you're all excited. We're now going to break into a little bit of basic anatomy and basic physiology. For those of you who don't want to look at graphics of breasts and uteruses, you can go outside. But we're going to talk about the basic anatomy and physiology of some of these organs so that we can understand a little bit better when people talk about them or when we ourselves discuss them with other individuals. So the breast, first of all. Simple graphic here. The breast is a complex of glands, fat, connective tissue, blood vessels, lymph nodes, positioned over the chest wall, obviously, and, forgive me, attached to the chest by ligaments that maintain its usual and expected posture. But you can appreciate in particular on this next slide the orientation of the ducts and the lobules that reside deep in the breast tissue itself, surrounded by outer laying fat and invested, as I mentioned, with blood vessels and lymphatic channels that drain away excess venous flow as well as any sort of inflammatory molecules and bring in white blood cells and the rest. You can see the basic anatomy as well, the areola, etc. But I want you to keep in the back of your mind in particular these, the ducts and the lobules. As most of you know, their primary disposition or purpose is really to provide milk, to produce milk for a woman who has had a child and has that need. But these breast ducts and lobules are exquisitely sensitive to hormones. Hormones that alter throughout a woman's life, through her menstrual cycles, the menopausal state, the pregnant state, etc. Keep that in the back of your mind, tuck it there, that these are lobules and ducts influenced by other glands and other tissues. Because when we talk about breast physiology, I wish I could say it was simple. It's not. And we're not going to go through this whole slide, but I want you to walk away with that both the process of producing breast, producing milk, and releasing milk is an extraordinarily complex process influenced by hormones that come from the pituitary and the hypothalamus in the brain, that come from adrenal glands, that come from the ovaries, that come from a host of different what we call endocrine tissues that release hormones into the bloodstream and then go to the breasts and there influence their formation and their milk production, their size, and a host of other aspects. But it's very complex. So there you are, complex, multi-system influence, and punctuated. I in particular want to put these up because we're going to talk quite a bit about these. But the idea that the development of the breast and the breast tissue itself is very much influenced by puberty, by the menstrual cycle, by pregnancy, and again by menopause. So keep this in the back of your mind when you're thinking about the breasts themselves and their exquisite sensitivity to the hormones. This was just a nice chart, I thought, too, showing kind of, you can see all these different things from the thyroid gland and the adrenals and all these different hormones going and influencing different parts of the body itself. Now, I believe I would be a bad physician if I didn't throw up at least one slide of this nature. Because I do think it's important that we as individuals, especially you ladies out there, keep track of the health of your breasts, because often you may, or your loved ones, be the first to notice a change. And these are some of the common changes that we attribute to breast cancer. Commonly a lump or a change in the texture of the breast, skin dimpling, where the skin begins to draw in or alter its normal smooth contours, a change in color or texture, an unusual color change on it would be particularly concerning there, and a change in how the nipple looks. So if you have always had inverted nipples, not a problem. But you should know that. If suddenly one nipple became inverted, you should be more concerned. And of course, the reason being that if something were growing within and drawing the tissue down, that would cause the nipple to invert on itself. And of course, any sort of discharge that was inappropriate or unexpected there. Those are things to think about. Now we're going to move on to the uterus, which, as you know, is carefully stored down and deep into the pelvis and the safety of the pelvis there. We're going to go through some of the basic anatomy of it. So the uterus is at the very top of the vagina, at the top of the vaginal vault. And there, the nose or the base of the uterus is the cervix. Then the uterus is a muscular pear-shaped sort of organ down in there. And the fallopian tubes that spread out like gentle arms across the sides. And very closely approximated to the uterus, of course, are the ovaries, as you can see here. In fact, they're in a reflection of tissue that comes down and binds around them, keeping them in place. So now, we talked a lot about the glands, about the lobules. Remember that? The lobules and the ducts in the breast. Well, very similarly, in the uterus, there is a tissue, an endometrium here, that lines the inner cavity of the uterus. And it is this tissue, this endometrium, which is sloughed off monthly in a woman's cycle. And this tissue, again, is, guess what? Very glandular, very responsive to what? Hormones, right? We're seeing a cycle. We're seeing a pattern here when it comes to different female organs that are particularly responsive to hormonal changes. And the physiology, much like the breast, is extraordinarily complex, multi-system. It's the same idea. We now again have the pituitary up in the brain, the hypothalamus, the thyroid, the adrenals, all of which can influence the activity of the uterus itself. So this is very important because sometimes we as individuals, and many allopathic physicians, become a bit sidetracked by one thing or another thing. But remember what I just said, many different areas of the body, the pituitary, the hypothalamus, the thyroid, the adrenals, etc., all are influencing the activity of the uterus itself. Key to remember in the back of our minds. Now, we mentioned, and again, this same sort of diagram of the punctuated opportunities in which the uterus is significantly influenced. You're going to remember that when we come to risk factors, so keep that in your mind. Now, just very briefly on the cervix, which we mentioned is at the base of the uterus, which you can appreciate here. These are some rather disturbing and graphic images to me of a uterus, in particular the cervix at the base here, that you can see a more normal cervix, and this is looking up toward it as a physician sees when doing a speculum examination. And you can appreciate here that slight changes in the frosty sort of appearance, and then the very cancerous appearing kind of changes that you see there. And that would be in an individual who had cervical cancer that was progressive in particular, okay? So things that we might see, but hopefully not. Then finally, just the ovary. Just a very brief comment. I won't spend a lot of time because they again are significantly influenced by hormones throughout the body, as you well know, and it's a multi-system punctuated sort of relationship as well. Now, one thing I do want to comment just briefly on. The breasts are relatively peripheral, and one is able to do whether it be self-breast examinations, thermography, mammography, MRI of the breast, etc., and quite readily take a look at the breasts and recognize if cancerous changes are occurring. The uterus and the cervix are often or relatively approachable. In particular, they will, if cancer has progressed in particular, we might see significant changes, whether it be an outflow, such as bloody discharge or these sort of changes, or in the case of the cervix examination by a physician with a speculum. Unfortunately, the ovaries provide very little that we can look at. They're so carefully tucked away deep in the pelvis that we don't have good tests to screen for any sort of cancers or any sort of changes that may occur. And as a result, you may have known someone who unfortunately passed from ovarian cancer, and sometimes it's referred really to as the silent killer. Now, just another slide here to remind you of the relationships. You can see the brain and the hypothalamus are releasing all these hormones, and this is within the menstrual cycle itself, and all of the changes we see here within the ovary and the changes in the lining of the endometrium of the uterus, and once again, just trying to drive home this point that when you talk about the power of hormones, the relationships of glands, etc., in particular in the female body, but also in the male and different organs, we can see that the breast, the ovary, the endometrium are dramatically influenced by other endocrine tissue, resulting in significant growth and changes throughout a woman's life and throughout her cycle. In fact, many of these hormones have dramatic effect throughout the body, estrogen in particular, as we talk about the changes that occur in the premenopausal and menopausal state, as we spoke of the other day. So in review, cancer is more common in hormonally responsive tissues. Sarcomas, the things we said were soft tissue or connective tissue cancers, are far less common. We hardly see them. And in large part, probably because the tissue that is more likely to become cancerous is more sensitive. It's more sensitive, all right, to the changes in its own environment. It is a complex and multifactorial relationship, however. And then, as I mentioned about the ease of diagnosis as well. Now, transition. We've talked a little bit about the anatomy, the physiology, the epidemiology. Look at this, we're knocking it out. Now we're going to talk a little bit about risk factors, because this is where it really gets important, right? So now we know it's dangerous, we know a little bit about the anatomy and physiology of the organism. Now let's talk about risk factors, because really there are two groups, non-modifiable and modifiable. I really don't care that much about non-modifiable, because I can't do anything about them, but we're going to talk about them anyway, because it's important to know. But what really matters to us are the modifiable ones, because that's something you can do about. The others you can just sit at home and worry about, and that does you no good, right? As our speaker this morning shared with us. So, breast cancer. What are the non-modifiable risk factors? They are your family history. If you had breast cancer previously, you are at an increased risk. If your mother, your sister, or a close first to second degree relative had breast cancer, you are at an increased risk. Your age. If you're over the age of 40, some say over the age of 45, you have an increased risk. If you are Caucasian, you have an increased risk. Although African American women die at a higher rate, Caucasian women are at higher risk for having breast cancer. Now, here's where it gets interesting. Early menstruation. Why? Hormones. Thank you, exactly. So because you have an earlier onset of menses, you see that hormonal change, that high amounts of estrogen and progesterone, which are growth factors within the body, more times. And for the same reason, a late menopause. Now, the beauty of a hygienic approach is that, in fact, most young girls who pursue a hygienic approach have, statistically, a later onset of menstruation. And whether it's good, bad, or otherwise, in this case it would be good, most hygienic women have an earlier onset of menopause. These are most of the studies in vegetarian and semi-vegetarian versus omnivorous or carnivorous women. Interesting. Now, when we talk about the modifiable, I have two groups up here, those in black and those in purple. Those in purple are up for debate to some extent, or the analysis and the studies, etc., are a little bit hairy. But the modifiable ones we know. No to late children greater than 35. So if you have not had children prior to the age of 35 or never had children, you are at an increased risk. Again, because of the hormones. You will have had more periods, more menstrual cycles than if you had been pregnant. And here for 9 months you had no periods, or even longer with breastfeeding. Again, OCP use, oral contraceptive pills, increase your risk. Again, the hormones. You're seeing a higher quantity of the estrogen or progesterone, whatever the base may be. Hormone replacement for postmenopausal women increases the risk of breast cancer. Breastfeeding greater than 1.5 years reduces your risk, okay? So the longer you breastfed your children, the better for you. Why? Again, the hormones. You're not having as frequent menstrual cycles. You're not having them for that whole long duration and that period. Alcohol use. How many of you saw the recent studies coming out that showed half a glass of alcohol can statistically increase a woman's risk of breast cancer? Anyone? Anyone? Yeah. So we used to think a small amount of alcohol, no big deal, it's all fine, it's all fun and games. But in fact, it now appears that consuming even small amounts of alcohol can increase a woman's risk of breast cancer. Obesity. Obesity, why? Because obesity is actually a silent state of chronic inflammation. And we're going to get into that a little bit later on. But it's releasing, unfortunately, belly fat doesn't just sit there and wiggle. You see, it's not just like St. Nicholas with a jar full of, whatever it is, full of jelly. But in fact, belly fat releases all manners of hormones that are pro-inflammatory and increase one's risk of cancer. Then, of course, night work, which is very interesting. But in the nurses' health study, they found that the nurses who worked the most night shifts had the highest risks of cancer. Previous abortions, this is somewhat up in the air, but there is some significant evidence to suggest that abortions alter estrogen and progesterone balance in such a way to increase the risk of future breast cancer. Tobacco, there is some evidence for that, though it's not particularly strong in this area of women's cancer. Then exercise habits. We do know, based again on the nurse's health study and the physician's health study, as well as the Framingham heart data, which are massive studies following hundreds of thousands of people over a long period of time, that regular exercise, about 150 minutes a week, can statistically and in a significant way reduce a woman's risk of breast cancer. And then